Hi, and welcome to the launch of our Gender Data and Planning resource for local government. My name's Casey, and I'm a health promotion worker at Women's Health Goulburn Northeast. To start, I'd like to acknowledge that we're intersectional in our approach, and I'm proud to stand beside generations of great women whose work has brought us closer to equality for all. I also want to acknowledge the wisdom, living culture, and connection of the traditional custodians of the unceded lands on which we work, and acknowledge the profound disruption of colonisation and the stolen generations on Aboriginal and Torres Strait Islander peoples. And finally, I want to state that we believe in a shared and just cultural transformation that embraces diversity, and these acknowledgements are part of the ethical principles that guide our work and conduct. This is the launch of a resource that's been many months in the making. To give you an overview of what we'll be talking about today, I'll start by giving a brief history of the project, talk you through some of the updates to the 2020 edition, and then about how it can be used in health and wellbeing planning. So as you may know, women's health works across the 12 local government areas of the Hume region. This project came about because we wanted to deepen our understanding of the extensive work of the local governments in our area in the health and wellbeing space. We really wanted to understand where local government were focusing their actions and resources to promote health and wellbeing in their communities. We also wanted to determine where we may have had intersecting priority areas. Our priority areas at the time the project started were sexual and reproductive health, prevention of violence against women, and healthy eating. We identified these areas as being the most pressing for the health and wellbeing of women, girls, and gender diverse people across our region. These priority areas also aligned with the Victorian Public Health and Wellbeing Plan. So in early 2016, we undertook a desktop audit of the municipal public health and wellbeing plans of each of the 12 local government areas. After this, we held follow-up interviews with representatives from some of these LGAs. An audit of the plans found that all 12 local government areas considered healthy eating as a priority area. 4 council plans identified sexual and reproductive health as a priority, and 9 identified the prevention of violence against women as a priority. So in response to the audit of these plans and the discussions we had with local government, Women's Health developed the first iteration of the Gender Data and Planning resource, which was specifically developed for local governments in the Hume region. It contained data and examples of strategies and actions that could be used in health and wellbeing planning, specific to our focus areas and applying a gender lens. It was distributed to our local government contacts as a resource that they could draw on. In 2020, the focus areas of women's health have slightly changed, and they now include climate change and gender equity as priority areas, as well as the prevention of violence against women and sexual and reproductive health. In the lead up to the next round of local government health and wellbeing planning, we conducted another desktop audit of the current plans across our region. This audit found an increase in plans that included the prevention of violence against women as a priority area from 9 in 2016 to all 12 in 2020. A decrease in plans that identified sexual and reproductive health as a priority area from 4 in 2016 to just 1 in 2020. And 8 local governments had included gender equity as a priority area, and 1 local government had a standalone gender equity plan. Findings from this audit inspired us to think about how we could encourage and support local government to consider including the priority areas that we consider the most pressing for women, girls, and gender diverse people in our region, and also how to support them in applying a gender lens to any priority area they identify as a priority in their community. Applying a gender lens to health and wellbeing planning can help to identify how men, women, and gender diverse people may experience an issue differently. It can help to identify specific barriers and enablers that impact how people of different genders receive and interact with policies, programs, and services. With the introduction of the Gender Equality Act from March 2021, all public sector organisations, including local government, will be required to apply a gender lens via a gender impact analysis in the review or creation of policies, programs, or services that have an impact on the community. Applying a gender lens to the next health and wellbeing plan will give local government a head start in promoting gender equity in their community and meeting their requirements under the Act. So today we're launching the new and improved Gender Data and Planning resource, or as we like to call it, the GDPR. On first glance, you'll see that the new version of the GDPR has been updated with our new branding, which aligns with our new website that we launched at our AGM last week. So if you haven't seen it, I recommend checking it out. We have the women's health priorities at the front of the resource, Each of these sections goes a little bit deeper than the others, as they are the priority areas that we have identified as most pressing for women, girls, and gender diverse people in our region. In the second half of the document, we've included the rest of the Victorian state priority areas. As I said before, this is to encourage the application of a gender lens to whichever priority areas you decide are most pressing for your community. In the Applying a Gender Lens section, we've highlighted the links to the Gender Equality Act, and we've also updated the format of the resource to make it easier to navigate. We've divided each section into 3 parts. At a glance, guidance for local government, a closer look, gender analysis, and the local context, statistics and case studies. The idea behind that is that depending on the capacity, time, depth of understanding of the user, they can pick and choose how deep they want to dive into understanding each of the gendered impacts of the focus areas. The At a Glance section provides clear recommendations for actions under the priority area. Here we can see some of the recommendations for partnerships under the Women's Health Priority Area, Gender Equity. Youth service providers, community health services, us at Women's Health, or local media. As you dig deeper into the actions, you could, for example, conduct a gender pay gap audit to ensure women and men are paid equally for work of equal value. And if you wanted to, you could simply just look at this section and take away ideas from this first at a glance piece. Or you could look closer and move into the next section to read the gender analysis. Keeping with this theme of conducting a pay gap audit, we could look to this section and read the following gender analysis: women earn less than men. Under this heading, you'll see further analysis of the gender pay gap, current statistics and contributing factors, then a link to Figure 1 for statistics, which takes us to the next section, the local context. Navigating to Figure 1, individual weekly income below minimum weekly wage, broken down by sex and LGA. At this point in time, data on gender diverse people is quite limited, so you'll find that the data in this resource is disaggregated by male and female. I'd also like to highlight that we're using the most up-to-date data available, a lot of which is ABS data from the latest census, which was in 2016. We'd like to recommend checking out the Victorian Women's Health Atlas if you haven't already. It's a great source of sex disaggregated data by LGA. So looking at this sex disaggregated data, you can see that the proportion of females earning less than the minimum weekly wage is much higher than the proportion of males across all LGAs. And you can't see the full graph here, but the state average shows a much higher proportion of females as well. So looking at this data set without disaggregating it by sex hides its gendered nature. And in the resource, each priority area follows a similar format: at a glance, a closer look, and the local context. But if you want to dive deeper into the specifics of gender equity within your LGA, we're just finishing collating a detailed snapshot for each one. They'll be available on our website soon. And the Gender Equity Snapshot covers demographics, the Mothers Index, education, leadership, workforce participation, and safety. It has a small gender analysis and statistics that show changes over time. So they can be used in conjunction with the GDPR or can be used as a standalone document. So in summary, this resource can be used to source ideas for strategies and partnerships for health and wellbeing planning, to explore the gendered nature of inequities within priority areas, and to source local statistics and compare against other LGAs in the Hume region and across the state. We hope you find it useful and we welcome your feedback. If you have any questions about the Gender Data and Planning resource, you can send them to me, k.mcdonald, MCDONALD, @whealth.com.au, or reach out to us via the contact details on the next slide. Thanks for joining us for the launch of the GDPR.